room.
Here's my MAR back and front. My apologies, I'm getting sick, but I need to get this done. All right, so I am going to review my patient chart. I have Joanne Peterson, 12-10-47, no allergies. She is in for a fall. And she was also diagnosed with dehydration. She has furosemide 20 milligrams by mouth daily, albuterol 2 puffs as needed for shortness of breath because her past medical history is hypertension and asthma. And she has acetaminophen 500 milligrams as needed for pain. In her handoff report, all of her vital signs look good. Her GI and GU are good. She is alert oriented to person, place, and time. Her pupils are equal, round, and reactive to light and accommodations. She has a high fall risk, so we're going to make sure her bed is kept in a low position. She does have an IV in, but we're not going to be doing any IV medications today, so I'm just going to check the site, make sure it's all good. And she is not up to date on her vaccination, so she'll need that during her stay. And the vaccination she has due is her Fluzone, so that's her flu vaccine. So I'm just going to go into the room, introduce myself to the patient, get any allergies that she doesn't have on her MAR, and I'll go over side effects. Knock, 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 hand hygiene, provide for privacy. Hi, Joanne. I'm Maddie. I'm going to be your nurse today. Can I have you verify your name and date of birth, please?
Joanne Peterson, 12-10-47.
I'm checking the armband. Perfect. All right, so I was just out at the nurse's station looking over your MAR, and it says that you're due for a vaccination today. It's going to be your flu vaccine. Is that something you're interested in receiving?
Yes, please.
Okay, so some side effects for that is you may experience some redness, some muscle soreness, some swelling at the site. If you experience any of those, let me know. Do you have any allergies that I need to be made aware of so I can go check to make sure that they're not going to interfere with anything?
Nope.
No allergies?
Nope.
Perfect. So I'm going to make sure you have your call light. That is in the low position and your side rails are up, and I'm going to go get that all set for you. And hygiene on my way out, provide for patient privacy. I'm at the MAR. So I have Fluzone. I have Joanne Peterson, date of birth 12-10-47. I have Fluzone for 0.5 milliliters intramuscular injection. It is due now. And then for my second check, I have Joanne Peterson, 12-10-47. No allergies. I have Fluzone 0.5 milliliters intramuscular injection, and it is due now. I am checking my vial. It is intact. It is not expired. And if I were to tip it upside down, nothing leaks out of it. So let's head in there. I'm going to knock, knock, provide for patient privacy, and I'm going to hand hygiene. Hey, Joanne, I'm back again. All right. So I just want to go over those side effects again. You may experience some redness, some swelling, and some muscle aches at the injection site, okay?
Okay.
So I have my gloves on. I'm going to go ahead and open everything. I'm going to be using a 25 gauge 1-inch needle because it's going intramuscular, so I want to make sure it goes into her muscle. So I'm going to open. I have a blunt needle that I'm going to use to draw up the medication. And then I have my syringe. All right, I'm gonna take an alcohol swab and clean the top of the vial. I've cleaned the top of the vial. Joanne, before you begin, can I have you verify your name and date of birth again, please?
Joanne Peterson, 12-10-47.
All right, I'm going to do my third med check. I have Joanne Peterson, 12-10-47, no allergies. I have Fluzone 0.5 milliliters intramuscular injection, and that is due now. So I'm going to take my blunt needle. I'm going to save my cap. I'm going to get rid of all those. I've cleaned the top of it. I'm going to pull up 0.5. I'm going to inject. And I'm going to flip it. Going to remove it. Okay, I have 0.5 drawn up. I'm going to recap. and remove of said needle. I'm then going to take my other needle, my injection needle, and I'm going to put that on. I'm going to take off my safety cap. That one can just go in there. And I have another alcohol swab. So I'm going to...
Let me check your...
Oh,
just so I can... For
0.5. Sorry, guys.
0.5. Nope, that's just for Carrie.
I'm going to clean it. And I'm going to be doing the Z-track method. Is there a way to put down the side rails?
Yeah.
I don't know. Okay, so I'm just gonna...
Do you want me to hold it?
No, I'm just gonna flip it. So for the Z-track, I'm gonna pull to the side and I'm gonna go bevel up. Just gonna go in at a 90-degree angle. I'm going to inject. Sorry.
Mine wasn't going either.
Remove the needle and then go to a hard surface to cap my needle. Okay,
There we go.
it's capped. Remove it. All right, Joanne, I'm gonna hang out with you for 15 to 30 minutes to see if you experience any side effects, okay?
Yeah.
Just gonna remove my gloves, hand hygiene, hang out for a little bit. All right, Joanne, it's been about 15 to 30 minutes. Are you experiencing any of those side effects that we talked about earlier?
Nope.
No? All right, I'm gonna make sure your bed is in the lowest position, your side rails are up, and you have your call light. All right, I will see you later. Remove myself from the room, provide for patient privacy, hand hygiene, and document.